Keynote speakers in the two-day Lake Region Economic Bloc Health Conference have called for transparency in procurement of medical equipment and drugs in county governments. Presiding over the closure of the two-day health conference for 13 counties in the Lake Region Economic Bloc, ODM party leader Raila Odinga said the health sector needs professional and sincere leaders. KTN's Fred Muturi has that story.
Now with a smile, let's do a selfie with your neighbor. With your good neighbor. I don't have any. Do the selfie.
The NASACOM principal Raila Odinga, who considers himself #1 defender of devolution in Kenya, has decried what he calls serious procurement challenges in the devolved health sector.
The econometric analysis reveals that out-of-pocket expenditures are a deterrent to health service utilization, are significantly and positively associated with catastrophic expenditure and with household poverty.
Raila cited cost, accountability, and the disconnect between the counties and national government as the greatest challenges for the devolved health system.
The time has come for our country to bring about a complete transformation of the health sector. Luckily, healthcare is a devolved function. This creates room for new thinking away from the old mindset that has bedeviled this critical sector since independence.
The irony of that is that if we have the bulk of the doctors who are working out here, we take our patients to other regions, and we are even exporting resources actually to those regions because the patients we take, we have to go and pay there.
We are particularly passionate that we should have more clinics in the rural areas for reproductive health rights, for prenatal and postnatal care, so that our mothers cannot die giving birth.
Governors were told to appreciate specialists from the region, particularly those that have ventured into the private health sector.
We in the region, we can assure you, health being a key issue, a key area, we are doing everything and determined to ensure that health of our people are improved.
And we discussed many things that we feel must help change health in Kenya generally, but most specifically because we agreed that we must begin at home.
We should carry out a joint feasibility study on the viability of a major pharmaceutical industry in the Great Lake regions. If Africa is to rise up, then we must become producers rather than consumers. And what better place to start than in the vibrant health sector?
The Lake region was also found to be leading in the number of people who are yet to register with the NHI fund.
Time has come for Kenya to roll out a medical scheme, including health insurance, that is capable of delivering quality health care services to all our people.
Fred Muturi, KTN News, Kisii.